P'nawn da, good afternoon, everyone. Apologies for being a couple of minutes late. Welcome to this extraordinary board meeting this afternoon. We've got two very important items to consider, which we'll come to the detail on in a moment. It's being live streamed through Zoom, the usual. In line with usual practice, you'll be able to review the recording of this on our website shortly. Simultaneous translation is not in place today. Apologies for that due to the extraordinary nature of the meeting. And I will crack on into the main item, the first item on the agenda. After asking, I've got apologies for absence from Evan Evans, the Executive Director of Strategy, Marion Wynne-Jones, Independent Member, and Andrew Fletcher, Associate Board Member. I don't think there's any other apologies looking around the screen. Declarations of interest. I've not been advised of any declarations of interest. Just for completeness, has nothing occurred to anyone since the papers went out? Thank you very much indeed. If we move on to the main agenda, and the first item is a verbal update on the transfer of NHS collaborative digital programs from the collaborative to DHCW, and a verbal update from a private meeting of the board to consider that transfer held earlier today. But can I ask, Helen, do you want to introduce, or happy to go straight to Michelle?
Happy to note that, and for Michelle to introduce this. Yeah.
Thank you, Helen. Michelle, welcome.
Thank you, Simon. Sorry, did we want to cover the transfer, or do you want me to jump straight into the contract award?
I got the transfer was down first on my brief.
Yep,
we'll do the transfer
okay.
first, and then we'll do the
award. So just to note the approval of the board. So this is to transfer the two programs currently operating under the NHS Collaborative, known as LINC and RISP. So that's the Laboratory Information Network Cymru and the Radiology Information System procurement programs, transferring off to Digital Health and Care Wales. I think the process that we're currently going through is a due diligence stage, so we need to understand the implications of the transfer in terms of the people working inside those programs, in terms of the financial resources and other resources and assets. So we'll be working through that process now as we move forward, and I'd expect to bring a detailed paper to the next board, setting out more details in terms of the nature of the transfer and some of the details underneath that, in terms of the, what will be coming over to the organisation and our approach to managing those obligations going forward within this organisation.
Thank you, Michelle. Does anyone have any questions or comments? Okay. Well, obviously it's been approved in private board, but I think it's appropriate that we note the receipt of that report, Chris, in the minutes, and we note that the approval of the boards to accept the transfer of those two programs. Thank you, Michelle. If we move on to the second item on the agenda today, which is a strategic procurement report, and Michelle, you are in the hot seat again.
Different hat. Okay, so thank you. I'm presenting Understanding Orders, a contract award for the approval of the board due to the value of the contract. I'll just run through a number of key aspects that are set out in the papers that you will have seen if they've been published. So the first thing to say is the framework contract. So what that means is there's no specific commitment for this organisation in relation to the agreement, but what it does is it sets a framework under which our health board and trust colleagues can call off and enter into direct contracts. It's for the delivery of hospital electronic prescribing and medicines administration. So the emphasis on the hospital there, but is often referred to as an EPMA solution. This is a solution we anticipate will be used principally in secondary care and in our hospital environments. It's been procured as part of the digital medicines transformation portfolio. So again, colleagues will be familiar. It's one of the key drivers there that we support the implementation of EPMA in the hospitals, and the framework has been established working with the Secondary Care EPMA Programme Board and under the Portfolio Board in order to enable the health boards and trusts to do so. So a couple of key points. As I say, we're appointing 3 suppliers, so it's actually 3 framework contracts. And there was a correction in the papers from the initial issue, so I'm just going to run through just to be very clear. The 3 suppliers to whom we're making an award are Better UK, Careflow Medicines Management, that was the correction that was issued, so apologies, there was an error in the original issue. Careflow, again, colleagues may be familiar with, previously trading under the JAC name, so it's now Careflow Medicines Management and Nerve Centre Software. So it's a 4-year framework agreement with the option to extend for a further 2 years. So during that period, health boards and or trusts in Wales would run their own mini competition process. So they would consider all 3 suppliers as a result of any competition. They would set out their requirements in detail. The framework does include a high level requirement. They would set those out in detail. We would expect that they would run a full evaluation, including system demonstrations and an assessment of the fitness for purpose within their particular environment. The high level requirements that the suppliers have been required to commit to in order to attain a place on the framework do include some of the key aspects, obviously things like interoperability, which will be very important in an environment where we may have more than one provider of these services in Wales. It was procured and run, it has been procured and run in this way really at the request of the health boards through the board, because they wanted that level of choice. So they wanted the flexibility to be able to choose a system and to reflect the fact that there are some differences within the health boards that they wanted to be able to support. But what it does do, it gives them the ability to do that. It gives those and some at different levels of progress, shall we say, across Wales. It gives those who are more ready to progress more quickly. And I know at least 1 or 2 of the health boards are very keen to proceed as quickly as they can with this, to draw this down. Other health boards may have other readiness activities that they need to undertake before they're in a position to do so. So it allows a bit of variability and pace, although this is a clear ministerial priority. So we will be working to encourage all of the health boards to move forward as quickly as possible. But the framework, it sets out the sort of contractual and commercial context under which the call-offs will be made. And as I say, the key requirements that any supplier would need to make. So the recommendation has been agreed by the Secondary Care EPMA Programme Board, and we have issued notification to Welsh Government of our intention to enter into the framework contract. The contract value, I should have picked that up earlier, you will note there's a maximum contract number on it, which is 100 million, which is the estimate of the most that would be expended under the agreement if all of the health boards and trusts call off, which we do expect, and they run it for the full duration possible. So Welsh Government have acknowledged that notification on the 18th of October. They confirmed that they understood that, that we were intending to enter into this agreement. So I'm now seeking the approval from the board for Digital Health and Care Wales to award the 3 framework contracts to those 3 suppliers.
Thank you. I've got a question, a hand up from Ruth.
Thanks, Simon. Thanks, Michelle. One comment and then one really stupid question. I think it's important. It's a massive amount of money potentially, but we have been looking at that in light of the benefits of the EPMA program, which are massive. So I think it's one of the bigger things that we will approve. But it's important that we just keep a focus on the benefits and how we actually derive full value from this program, and that's financial and non-financial benefits. And I know that we're looking at that, and that's key to the success of the delivery of this such an important plan for Wales. And then my stupid question is the setup costs or the implementation costs, is that a percentage of the overall spend as we draw it down, or do we pay 2 million quid whether we spend 1 pence or 98 million?
No, so that again is an estimate, Ruth, across if all of the health boards and trusts call off and they all implement the solution. That's
so it's
the
proportionate
the
then. It's not. Yeah. It's not an upfront. Here you go.
No.
Perfect. Thank you.
Thank you, Ruth. Any other questions or comments? As Ruth pointed out, this is it's a very big day. It's a huge milestone in development of digital transformation. And something that is going to make a big, huge difference and a great, enormous first step in the delivery of the digital medicines program. So thank you and all your team for your hard work, Michelle, and getting us to this point. And I will now ask the board if they are happy to approve the acceptance of these 3 contractors onto the 3 frameworks. Yes, thank you all very much indeed. I'm not going to keep any more of your time. There is no other urgent business being brought to my attention. The date of our next meeting, this is our next public board meeting, it's Thursday the 24th of November. And on that note, I'll bring this meeting to a close. Thank you all very much. Have a good rest of the day.
Thank you.